to do that and appreciate the specificity. I'd like to ask next about Dylan and Kim. They're two of many parents in my community who've shared with me what it's like to raise a child living with CF. In their case, it's their son Jackson. Now, as you know, Madam Chair, kids like Jackson need expensive medication like Trikafta that can significantly improve their quality of life. Given the high cost of Trikafta and other CF drugs, many families struggle to afford it unless covered by private insurance. Those that don't have access often only do, or those that do have access only do because of private access through their, or private insurance through their employer. It often means that the value of this coverage is actually more than the person makes in their salary. Of course, no child should go without essential treatment due to their family's financial constraints. My question for the minister is, can he share when this government plans to move forward with the pharmacare program that would include drugs like Trikafta, and at minimum, maybe at least would require private insurers to cover the drugs that public plans do, as I understand already is the case in Quebec, and as CF Canada is calling for?
The Honourable Minister.
Thank you very much, Madam Speaker. So first of all, to Dylan and Kim, I appreciate your advocacy. I can't imagine how difficult that circumstance is, and that's exactly what we want to shut down. This is precisely why we're acting in pharmacare. Now, one of the questions that we have, and I think it's very important, we have a pilot in PI that's working very well. It's based on a fill-in-the-gaps model. The model that Bill C-64 is based on a universal model. And so looking at now in a real world, those two models and which one is best to use as a delivery mechanism for all drugs is, I think, the question. We have a committee that's going to be looking at that over the next year and really painting that path forward. So these are very active matters of consideration. And I think it's one of the reasons why it's so important we establish that bedrock, which is the legislative foundation for pharmacare in Bill C-64, and take this action so that we can make sure that we get to help families like Dylan and Kim. That is envisioned in Bill C-64, but very much in my heart and in my mind as we're working.
Thank you, Madam Chair. As the Minister likely knows, I'm hesitant to use the word pharmacare at this point because it's so restrictive to contraceptives and diabetes. I know that that's his vision for where he wants it to go. I'm thinking for parents like Dylan and Kim who want to understand more when this could be expanded to them, could we hear at least the Minister's aspiration for when he would look to see that expansion in place?
The Honourable Minister.
Well, thank you, Madam Speaker. And I would say that our healthcare system has always been iterative. We've built it out a piece at a time, and and that means that, one of the most frustrating things for me as health minister is to go to different parts of the country and hear stories of things that we could do on a preventative basis and aren't doing. I mean, we could talk about in Iqaluit, I was up talking with Indigenous leaders, Inuit leaders rather, about tuberculosis outbreaks out there. Like, there are things that we still have happening.
The Honourable Member.
Thank you, Madam Chair, and I would love to continue that conversation with the Minister. As the